Diabetes may affect more than your body. It can quietly impair your brain. These 10 signs could be the earliest warnings of dementia you should never ignore. Everyone misplaces keys or forgets a name sometimes, but frequent, uncharacteristic memory lapses in someone with diabetes can be an early red flag. Perhaps you find yourself asking the same question repeatedly, or forgetting recent conversations. Studies have found that type 2 diabetes is associated with memory deficits, a measurable drop in the ability to remember information. This isn't just normal aging. High blood sugar and insulin resistance can damage the hippocampus, the brain's memory center, making it harder to form and retrieve memories. If you're living with diabetes and notice that your memory feels foggier than it used to, take note. These memory slips may be your brain's quiet cry for help, a subtle hint that diabetes could be eroding your recall. Struggling to follow a familiar recipe or balance the checkbook lately? Trouble managing the very routine of diabetes care, like remembering medications or planning meals? These could be signs of impaired executive function, the brain's ability to plan, organize, and solve problems. Doctors warn that diabetes-related cognitive impairment often shows up as problems with attention and executive tasks, essentially trouble to start, conduct, and finish a complex task. You might find it hard to make decisions, finish projects, or follow instructions that used to be second nature. This isn't laziness or lack of effort. It can be a direct effect of diabetes on the brain. When blood sugar swings high and low over years, the brain's frontal lobe, which controls planning and decision-making, can suffer. Pay attention to these changes. If diabetes is making the once simple tasks difficult, it could be an early warning sign of cognitive decline creeping in. Many people with diabetes describe a sensation of brain fog, as if their mind is wrapped in a haze. Do you find it hard to stay focused on what you're doing, or catch yourself losing your train of thought often? Diabetes can be the culprit. Frequent high blood glucose can literally cloud your thinking. Insufficient blood flow and nutrient delivery to the brain leave you feeling mentally sluggish. On the other hand, low blood sugar episodes can cause confusion and difficulty concentrating as well, essentially starving brain cells of fuel. Symptoms of diabetes-related brain fog include confusion, trouble finding the right words, and an inability to concentrate. If you're drifting off during conversations or reading passages over and over to grasp them, don't just write it off to stress. In a person with diabetes, this persistent brain fog is a whispering warning that the disease may be affecting the brain's clarity. Do your thoughts feel like they're moving in slow motion? Perhaps you've noticed it takes longer to solve a simple puzzle or respond to a question. This too can be an early sign of diabetes-related cognitive decline. Researchers have observed a decrease in processing speed, essentially a slowing of thought and reaction, in people with type 2 diabetes. You might experience it as prolonged pauses to find the right word, or feeling overwhelmed by information that you used to handle quickly. It's as if the mental gears are grinding more slowly than before. High blood sugar can damage blood vessels and nerves, which may leave the brain working less efficiently. While this change can be subtle, if you or a loved one with diabetes consistently feels that thinking has become slower or more labored, consider it a sign. The mind should not feel like it's wading through mud. It could be diabetes quietly pressing the brakes on your cognitive speed. Moments of confusion can be unsettling, like arriving at the top of the stairs and not remembering why you went up, or briefly not recognizing a once familiar street. In diabetes, such episodes might hint at emerging cognitive issues. We all have the occasional mental mix-up, but frequent disorientation in familiar places or situations is cause for concern. People developing mild cognitive impairment may start to have trouble navigating places they know well, or forget why they entered a room. In the context of diabetes, there are physiological reasons for this. Fluctuating glucose levels can affect neurotransmitters and blood flow, making the brain prone to confusion. If you find these bewildering moments happening often, for instance, getting lost driving to a neighborhood store or feeling momentarily unsure of where you are, listen to that alarm. Such disorientation, though fleeting, could be an early sign that diabetes is impacting your brain's spatial orientation and general awareness. The mind and mood are deeply connected. If you have diabetes and notice you've been feeling persistently down, anxious, or unusually irritable, pay close attention. Depression is common in people with diabetes, and not just as an emotional response. It may also be a sign of diabetes affecting the brain. In fact, research shows that having diabetes plus depression further increases the risk of cognitive decline or dementia beyond diabetes alone. Perhaps you've lost interest in hobbies you love, or family members comment that you seem different, quieter, sadder, or quicker to anger. These mood shifts can be early indicators of changes in the brain. Experts note that people with early cognitive impairment often experience depression, anxiety, a short temper, or apathy, loss of interest. Biologically, blood sugar extremes and insulin resistance can alter brain chemistry and damage blood vessels, contributing to mood and personality changes. So, if diabetes has you feeling hopeless, chronically fatigued, or on an emotional roller coaster, recognize this sign for what it is. It's not a personal failing. It may be a medical warning that your brain health needs attention, just like your body does. Few things feel as immediate and alarming as hypoglycemia, the dizziness, shakiness, confusion, or even blackouts when blood sugar plummets. If severe low blood sugar episodes are happening often, they are more than just acute emergencies. They are potential harbingers of long-term brain injury. Hypoglycemia deprives brain cells of glucose, their essential fuel. Over time, repeated episodes can cause cumulative damage. A study in JAMA Internal Medicine found that older diabetics who had even one severe hypoglycemic event were twice as likely to develop dementia compared to those who never had such lows. In essence, each crash in blood sugar can inflict a tiny trauma on the brain, and those add up. Moreover, there's a vicious cycle. Diabetes can impair cognition, which in turn makes it harder to manage medications or diet, leading to more hypoglycemia. If you're frequently experiencing shaky, confused spells from low sugar, treat it as a serious warning sign. Your body is telling you that your diabetes management needs adjustment, and your brain will thank you, because breaking the cycle of hypos could help protect it from further harm. Just as lows are dangerous, so are highs. Chronically elevated blood sugar levels, the hallmark of uncontrolled diabetes, act like a slow poison to many organs, including the brain. You might notice signs of high blood sugar such as constant thirst, frequent urination, or fatigue. But what you can't see is the inflammation and oxidative stress that high glucose triggers in your brain. High blood sugar causes inflammation that can damage brain cells and set the stage for dementia. Think of it as a heat that slowly warps the delicate wiring of the brain. Over years, poorly controlled diabetes can shrink brain regions and harden blood vessels, the kind of changes that are also seen in Alzheimer's and vascular dementia. Medical researchers have linked chronic hyperglycemia with cognitive decline in people with diabetes. So if your hemoglobin A1C has been high or your daily blood sugars often spike above target, consider it more than a general health warning. Consider it a cognitive warning sign. The damage from high sugar may be silent now, but down the road it can speak through memory loss and confusion. Keeping blood sugar in check is not just about the heart, kidneys, or eyes, but about preserving your mind as well. Diabetes is a disease of the whole body, and often the complications come in groups. If you're noticing progression in complications like diabetic retinopathy, worsening vision, neuropathy, nerve pain, or numbness in your hands or feet, or kidney disease, you should also be thinking about your brain. These complications are a sign that diabetes has been damaging your blood vessels for years, and the brain has a vast network of blood vessels that can be affected too. In fact, the same microvascular damage that causes eye or kidney problems is linked to cognitive impairment in diabetes. For example, studies have found that patients with diabetic eye disease are more prone to cognitive decline, likely because both involve weakened blood circulation to vital tissues. So, if your diabetes complications are piling up or worsening, consider it a warning sign that your brain might be under attack as well. It's emotionally tough to face multiple health issues, but there is a silver lining. These complications give you clear evidence and motivation to act. They whisper, "Take care, your brain might need help too." By recognizing that all these issues are connected, you can work with your doctor to protect your overall health, including your cognitive health, more effectively. The final warning sign is woven into the story of your diabetes itself: time. The longer you have lived with diabetes, the greater the cumulative exposure of your brain to high sugar and metabolic stress. Especially if you were diagnosed with type 2 diabetes at a younger age, your risk of dementia later on is higher simply because your brain faces more years under the strain of diabetes. A recent Harvard report put it plainly. These striking results clearly show that the earlier you develop diabetes, the greater your risk is for developing dementia. Similarly, the Alzheimer's Society reports that dementia risk rises with longer duration and greater severity of diabetes. It's a sobering thought. A person who has managed diabetes for 30 years may be more at risk than someone with 5 years under their belt. But this isn't meant to instill fear. Rather, it's to encourage vigilance. If you're a long-time diabetes warrior, be proactive in watching for cognitive changes even if you're not yet very old. And if you developed diabetes young, know that your future self will thank you for keeping your diabetes well controlled now. Time with diabetes is like a gentle river wearing down the rocks of cognition. The longer the flow, the more the wear. Recognizing this helps you stay alert to even subtle shifts in memory, thinking, or personality over the years. Each of these 10 signs is a message, sometimes whispered, sometimes shouted from your body and brain. On their own, any one sign could be due to other causes, or just an off day. But if you have diabetes, and you recognize several of these warning signs in yourself or a loved one, listen to those messages. It's easy to feel afraid or overwhelmed, but there is hope and strength in knowledge. The sooner you acknowledge these signs, the sooner you can seek guidance. Consulting your doctor about memory lapses or mood changes is not overreacting. It's a wise and brave step. They can evaluate whether it's mild cognitive impairment, dementia, or perhaps something more manageable. Sometimes addressing blood sugar fluctuations or other issues can improve these symptoms. Remember, seeking help is a sign of strength, not weakness. It shows courage and self-care. You're not alone on this journey with diabetes. And by speaking up about changes you notice, you take control of your story. Early recognition can lead to interventions that may slow cognitive decline or simply help you manage it better. In the serious tone of this discussion lies a gentle promise. Noticing the early warning signs gives you a chance to fight back. Cherish your mind and memories, and if you notice them falter, reach out. There is support, there is guidance, and there is power in taking action, because understanding what's happening is the first step to protecting the life and memories you love.